Hi, everybody. It's really nice to be here. So I'm going to talk about digital mental health, really digital mental health software. So we're kind of at the data collection end of data science with this. And I'm going to talk about it through the lens of engagement and various aspects of engagement that we work across with the different projects that we have. So just by way of introduction, so for quite a few years now, I've led the digital health software team at the University of Manchester. And we're a team of about 15 to 20 people, but as Johnny said, it takes a village to build some of these things. So we work very closely with other groups across the university and with other national groups as well. And we build software to support different kinds of health research. So not just mental health, although mental health is a real area of focus for us. And we tend to use agile approaches. So people are probably familiar with that, but it means we build software as quickly as we can. We get it out to end users for testing and for feedback, and then we refine it based on what people tell us, what kind of changes they would like to make with the software. So we do a lot of co-design work and user research and working with our end users, that we patients, clinicians, academics, other researchers, and so on. And we're a little bit different to maybe a software consultancy house. Maybe people have worked with those before, where you would design a set of requirements, you would hand it off and they would build something and then they would deliver a piece of software to you. So we're very much embedded within the research team from the start. So we see ourselves as a research group, not just a software development group. And a lot of the things that we're building these days are regulated as medical devices. And that's typically because we're either building an intervention that's delivering a therapy, or we're changing the clinical pathway some way. So we're flagging a risk and clinicians need to respond to it. So the software we're building is actually influencing clinical decision-making. So I thought to take you through some of the projects that we're working on, I thought engagement might be one way to think about things. So I'm thinking about engagement in different ways, really. So when we talk about engagement, we're thinking about how do we use the technology to reach underserved and underrepresented groups, because we've got huge potential, obviously, with digital tech to engage underserved groups in some of the research that we do. Obviously, there is the digital divide and there's problems of access and digital literacy and so on. But on the other hand, we've got an opportunity here to reach groups that otherwise wouldn't be able to be involved in different kinds of research that we do. And then related to that, how do we harness some of the opportunities to collect data for research? And I'll talk about some of the projects that we're doing on that as well. And then one of the challenges that we face when we're building things like a digital therapeutics or delivering a therapy through an app is how do we keep people engaged in the apps? So obviously we know the dropout rates for digital mental health tools is really high. People tend to use them for a few days, maybe a few weeks, and then they stop using them. So what can we do digitally to try and keep people engaged in using the apps that we're building? So starting with the first strand of engagement work. So this is an example from the NIHR Applied Research Collaboration, Greater Manchester. And really the problem we had was that we were doing a lot of face-to-face PPIE work, and we tended to see the same people come to our PPI workshops again and again, or people from similar backgrounds. I know there's a lot of PPIE experts in the room who are probably much better at doing this than we were, but we were really struggling, and we talked to other researchers and they were having the same problems. They didn't really know how to recruit. They weren't getting a diversity of participants attending. And so we wanted to do something digitally, or try to do something digitally to improve things and get more people involved in research. So we built what we call VoiceIn. It's a digital platform for patient and public involvement in health research. It started out as young people's project in mental health research. So when we talk to young people and we ask them why they weren't getting involved in research or in PPIE opportunities, they told us, they found it pretty boring to come to the university and sit for 2 hours in a focus group and listen to us. They didn't really fit with their lifestyle, but they do use their phones a lot, and they did want to participate in research, and they wanted a way to contribute that was easy and fun and fit with their lifestyles. So we built the VoiceIn platform. So what does it do? It's a bit like Tinder for PPIE. So researchers upload their projects. They give a description of the project. They have their interest areas that are related to it. Young people then can download the app. They select what interests they have, the kind of topics they want to hear about, and then they can be matched with different research projects. And the nice thing about it is that it enables researchers to keep in touch with people who've contributed as well. So that was one of the things that came through from some of the co-design work that we did. People really wanted to get updates. How is their contribution making an impact? And they told us that often they went to focus groups, face-to-face events, and they maybe got a letter, thank you for contributing, and the project's on the next stage, but then that was it. So they never knew what really was happening with the research. So that's something that VoiceIn tries to enable as well. Okay, something different then. This is part of the Datamine project. So it's the equity audit tool, but it's also about trying to tackle this problem of underserved groups in research. So we're building an equity audit tool to enable routine equity auditing of mental health clinical trial data, trying to understand the representativeness of participants in clinical trials across UK mental health studies. So we're working with the Clinical Research Network of the NIHR, and what we want to do is to try and identify specific underserved groups within the portfolio as a whole, and then within individual mental health clinical trials. And so the whole point of this is, how do we support better engagement? How do we flag up to people running trials, your trial is not recruiting a representative sample, this is where the gaps are, this is how you might want to recruit to a more representative sample in future. And another project that's part of the Datamine Road Builder that we're working on, it started life as an NIHR grant and now has migrated into Datamine. So it's about collecting mental health questionnaire from people involved in physical health clinical studies. So obviously we want to understand better the links between physical health and mental health. And we want to seize the opportunity to engage people who are already engaged in research and build up a data set that has the richness of physical and mental health side by side. And a slightly different project, it's called NCAMS. It's also NIHR funded, and it's about trying to enhance the CAMS referral pathway. So Johnny was already talking about some of the problems in CAMS. One of the problems that we identified early on when we started this investigating for this project is about 25% of people who are referred into CAMS are rejected at the point of triage. So often people wait, children wait, and their families wait for 8, maybe 12 weeks, and then they receive a rejection letter, and they don't often or don't always receive clear signposting to alternative services. So it's obviously a hugely distressing process for people as they wait for this outcome to happen, and then they don't know what to do at the end of it. And GPs who refer in and school staff were telling us the same story. So we talked to lots and lots of people for over the last 18 months or so, trying to understand all the problems. And there's many presentations on that I could go into, but I won't. But what we're trying to do now is identify how can we help digitally with some of these problems. So some of the things that came up, for example, people are just not being notified about what the expected waiting times are. They're not being signposted to alternatives. There's no real digital touch points along the way that people are informed about. So we're trying to think, are there things we can do with digital tech to improve things along the way and to keep people more engaged in the process. And this is the third kind of engagement challenge or opportunity, I suppose. It's the Connect project. It's led by Sandra Bucci at the University of Manchester, and we're on board building the digital platform. And the goal for it is to identify digital markers to predict psychosis relapse. So people with psychosis will be submitting active and passive data to us, we hope, for 12 months. So active data, that'll be active symptom data. They'll submit a questionnaire through a mobile app and send it to the research platform. We want them to submit a questionnaire daily in an ideal scenario for 12 months. And passive data, they'll have a watch or wearable device where they can transmit the data passively to us, and we'll collect it from their smartphone as well. As you can imagine, asking people to send us data for 12 months is a big ask anyway. Passive data maybe less so, but active data, asking people to respond to a questionnaire constantly is a challenge. And we've worked quite extensively with the lived experience group trying to understand what would be drivers, how do we keep people motivated, how do we build a community of participants and make people feel like they're doing something meaningful, which we hope they are, and also building in some gamification techniques into the app to try and encourage people. So you'll be familiar with streaks probably and things like that, that you might, if you've used Duolingo or Garmin watches or Fitbits or whatever, you often have streaks that you've done a certain activity for a certain number of days and you've met your goals. So we're trying to think about gamification ways to build some motivation into the Connect project as well. We'll see how it goes. It's just starting out. And a similar challenge we had on the Imlines project. So that's a project also led by Sandra. So it's a multimedia interactive platform. It's an app that young people use. It's designed for young people who have experience of online sexual abuse. And it's trying to deliver really a kind of therapy through an app to enable young people to understand more clearly the motives of adults and peers. So trying to help people feel more confident in challenging situations, and when there's ambiguity in those situations, trying to guide people through a process. But obviously one of the challenges is we need to keep people engaged to work through the modules and the session content. And so you can see in the picture there that we had this idea of a tree. It came from the lived experience group, and every time they complete a module or a session, you get a new leaf on the tree. So it starts out bare and you start to grow leaves as you progress through the sessions. So we've just been working with people trying to think about what ways would be meaningful and useful to try and support engagement in the digital tools. And I suppose overall, one of the things, digital tech can create inequalities, but we've got a huge opportunity in terms of accessibility and the kinds of digital accessibility methods we can use. So we try to build software that's easy to use for as many people as possible, trying to create translated materials where we can, and text-to-speech options, change the default font size to be bigger for people with visual impairments, trying to encourage researchers to avoid jargon. So we have a jargon detector in the PPIE app to try and stop researchers pushing out things that most people don't understand, and making sure that the software works with assistive technologies, so screen readers and things like that. And that's the end of the tour of various different projects and just the acknowledgements to the funders. Thanks, everybody.
Pauline, thank you. Please have a seat. Every time I talk to Pauline or hear Pauline talk, I think I'm looking into the future. She's done lots of things are completely alien to me. What do you think the future will look like? For me, an old fossil who is wearable devices, apps, and a lot of mobile things. So paint a picture of what you think the future will look like in terms of how you interact with people, especially younger people, through technologies.
Yeah, that's a good question. I feel a bit old to answer that question almost, because when I talk to young people in our advisory group, I'm always kind of blown away by what they're doing already. In terms of research, though, I mean, collecting passive data is a huge area at the moment, collecting it from wearable devices where people don't have to actively submit things. Questionnaires are great and you can capture data, but being able to capture data passively, I think, is a huge area of research at the moment and going to grow and grow across the piece, definitely.
Excellent. Questions? Yes, if you can say who you are and state your question.
Hi, I'm Michael McTurnan. I'm from the Datamine RAG Research Advisory Group. My question is really, well, it's about, I think you're spot on, that engagement is absolutely the most important thing in terms of mobile and digital health. I'm sort of intrigued as to how you balance engaging people with gamification techniques that might be anxiety driving, because quite a lot, like Streaks and Duolingo, are anxiety driving. That's why they keep me on Duolingo every morning. But the second part is, how do you evaluate the impact that these apps have? I think it's a difficult problem for a lot of digital apps. You think about Headspace or Calm. Yeah, they're brilliant, but what impact do they have? So yeah, two things. How do you keep on the right side of gamification, and how do you measure the impact that you have?
Yeah, really good questions. On the first one, so staying on the right side of gamification, I mean, it is a challenge, and there's no definitive guidelines around this at the moment. I mean, it's an emerging space. And yeah, some of the commercial apps are really quite aggressive in some of the gamification techniques that they do. I mean, for us in terms of research, we will have advisory boards to guide us. We'll talk to the lived experience groups. I don't know that we have definitive answers for anything yet. It's a bit trial and error still at the moment. Obviously safety first, so we try to do things that are less, obviously not anxiety provoking, and trying to keep on the right side of that, but also just working with groups to understand what they think about it. It is a real challenge because on the one hand, you want people to submit data, but you don't want to pester them or create a new problem for them. So it's a real challenge, and particularly with young people, you need to limit the time that they're using their mobile phone usually. So you don't want them, you might want them to complete the module, but you don't want them spending 5 hours on their phone every day. So there's a balance there, and often you build in advice and guidance around how much time people should spend doing something, or you time the app out after a certain time so that they're not spending too long on it. I think that's not a problem we usually see with lots of the apps, but it can be. So it's definitely something, and limiting the duration is definitely something that people do to try and stay on the right side of that. And the second question, in terms of measuring the impact, I mean, there's different ways to look at that. In terms of around engagement, it's really difficult sometimes to define what you want in terms of effective engagement. You know, what does it mean to engage effectively with an app? What is it, number of sessions? Is it module completion? People are moving more towards that. If it's a therapy, sort of active therapy delivery, then module completion can be quite important, but it's not usually number of logins or duration of use, which is what people historically looked at. It's much more about how do people engage effectively. And there are various frameworks. So we use the AMUSE framework usually at the start of a project to map out, you know, which metrics we're interested in and how we're going to assess them at the end, whether or not something was successful. But again, it's emerging, so there's no black and white answers on that, unfortunately, either.
Any other questions? Yes.
Hi, I'm Jane Taylor, and I'm also a member of the Datamine Research Advisory Group. I'm very interested in your Connect project, and I know you're just at the beginning, but as someone who's cared for many years for someone with schizophrenia and I'm very involved in his community, one of the issues I notice all the time and I've experienced is that often when people are having relapses, they often think that they're getting messages through their phones, and they're very frightened of technology for that reason. And I just wondered how do you square that, or how do you anticipate, or do you anticipate difficulties with that?
Yeah, absolutely. And I should say Connect builds on a series of research projects funded by the Medical Research Council previously that explored similar areas. So we used a smartphone to capture active symptom data from people with psychosis. And that is an important issue. One of the safeguards we build around is obviously, you know, don't use your phone if you feel too unwell to do it. We've got regular check-in calls with the researcher to make sure that people are okay. That is definitely a challenge. And that's something that we, you know, make clear to people at the start and guide people around how to protect themselves if they feel like this is not, and it's not for everybody. That's the other thing to say. You know, if somebody has a particular problem with hearing things through a phone or getting messages through a phone, that is probably not the intervention for them, but it's something that has worked in the past with other people and something we need to build safety checks around for sure.
One of the things that I'm hearing technological innovation all the time, and I'm just wondering, is there a tension between that and integration? So you've and Johnny as well are developing systems that work locally, and agile is what you've mentioned before as well. So they work locally for the needs of the locality. But I wonder, is there a difficulty with integrating into the wider networking system so that it can be rolled out, so that if somebody then trying to get an overall picture across the country of what's happening has difficulty because you've just now got a new patchwork of stuff that's constantly changing?
It's a really good question. It's a really difficult challenge. So this challenge of interoperability with different systems, it is a nightmare at the moment because everybody's on a different system. All the information governance processes across different trusts are different. You've got to navigate them. You know, each time you go to a new trust, they pretty much have a different system to navigate. So you're trying to integrate with a new set of rules and regulations. It's really, really difficult. You know, usually we aspire, particularly at the grant application stage, of saying that we're going to be interoperable with everything, and then the reality comes and you integrate with whatever is available and whoever will play with you in that particular moment. It's really, really difficult.
Yes.
Yeah.
Any other questions? Yes.
Hi, I'm Jasmine from UCL. I had a question about data privacy, because obviously you use a lot of these tools, and I think especially with the Connect project, if you're working with people who might have a lot of distrust towards people, how do you get them to be willing to hand in all this data, especially for a long period of time? So like, what were some challenges you faced in terms of privacy with all these apps, and how are you planning to overcome them? Thank you.
It's a really good question. And it's something that comes up again and again when we talk to the lived experience group. You know, how are we going to explain to people that their data is safe, that we go through a series of data security processes? And we're working at the moment actually to make a set of materials for people to explain really clearly the kind of data security that's in place to protect their data, to make really clear to people who can see their data, what level they can see it at, whether it's identifiable or anonymized or aggregated, to simplify. And it's not actually trivial to explain that in a really clear line. I mean, it's quite hard to just have discussions among peers about where the data will sit and how it will be secured and what kind of security testing is done around it, you know. But we're working really hard with the advisory groups to try and make that really understandable to people. And once we do explain it to people, well, it has been our experience in the past, people are happy that the data is being used for, social good. It's a social license idea that people will share their data if it's being put to good use and benefiting hopefully other people. So people are willing to share it, but making clear the messages that, we're not going to track exactly where you are 24 hours a day, and we're not going to misuse the data that you give us is really important message. And we put a lot of time into trying to explain that to people.
Yes, Johnny.
Oh,
sorry.
Yeah, no, it was just a quick question around the kind of the metrics for usability. Thank you. Because we're really struggling to really work out what to measure, and we're kind of driven by essentially commercial applications for metrics, which are really orientated around retention. And retention is not necessarily, I mean, we generally want to treat and discharge and not retain people on these particular tools forever. So do you think that the kind of commercial package metrics, the stuff we get from Google Analytics, are fit for purpose? And is there anything we can do in terms of developing software applications where we say this is probably quite a good standard for the types of metrics that we think would be applicable to mental health digital therapeutic?
Yeah, to answer the second bit first, I think there's a lot of work we could do to develop some standards, absolutely. In terms of the commercial applications and what they capture, I mean, they capture masses of information, right? I think the challenge is how do you narrow down what's actually useful and interesting? So we use the Amuse framework. I can send you a link to that. And so at the start of our project, we map out, what is clinically relevant here or what's relevant to the goals of the research project, and try and map that to the data that we could collect. Usually, I mean, the analytics packages will give us way more than we actually need or could ever analyze. So the challenge is trying to understand which bits are going to be relevant to look at. And it is difficult. I mean, I'll send you some links to some papers about it as well. People are still debating which metrics we should be looking at and which ones make sense for different kinds of applications.
I think that's it for the questions. There are lots of other opportunities to ask questions over tea, coffee, and lunch, and so on and so forth. But can we please thank Pauline for her presentation.